Hypertension, also known as high blood pressure, is a medical condition characterized by elevated pressure of the blood in the arteries. It occurs when the force of the blood against the artery walls is consistently too high, and can lead to serious health problems, such as heart disease, stroke, and kidney disease if left untreated. Hypertension is a major risk factor for several serious health conditions. Over time, high blood pressure can damage the blood vessels and lead to the following conditions: heart disease and heart attack, stroke, kidney disease, vision loss, cognitive decline, sexual dysfunction, peripheral artery disease. In addition to increasing the risk of these health problems, uncontrolled hypertension can also make existing medical conditions worse, such as diabetes and sleep apnea. Risk factors for developing hypertension include age. The risk of hypertension increases with age. Family history. Having a family history of high blood pressure increases the risk. Obesity. Excess weight increases the workload on the heart and blood vessels. Physical inactivity. Lack of physical activity increases the risk. Poor diet. A diet high in salt, fat, and sugar increases the risk. Tobacco use. Smoking and using tobacco products increases the risk. Alcohol consumption. Excessive alcohol consumption can raise blood pressure. Stress. Chronic stress can increase blood pressure. Hypertension is often referred to as the silent killer, because it often does not have any noticeable symptoms. However, in some cases, people with very high blood pressure may experience symptoms such as headaches, dizziness, nausea, chest pain, blurred vision, shortness of breath, ringing in the ears, tinnitus. It's important to note that these symptoms are usually only present in severe cases of hypertension and that most people with high blood pressure do not experience any symptoms at all. This is why regular blood pressure monitoring is crucial for detecting and managing hypertension. The diagnosis of hypertension, high blood pressure, is typically based on multiple readings taken during different visits to the doctor. A single elevated reading does not necessarily mean that a person has hypertension, as blood pressure can fluctuate due to various factors such as stress, exercise, or caffeine consumption. To diagnose hypertension, the following criteria are usually used. A systolic blood pressure, the top number, of 130 mm of mercury or higher, and/or a diastolic blood pressure, the bottom number, of 80 mm of mercury or higher. The American Heart Association recommends that people have their blood pressure checked at least once every 2 years, and more frequently if they have already been diagnosed with hypertension or have other risk factors for the condition. In some cases, a healthcare provider may also order additional tests to determine the cause of high blood pressure, such as blood tests, urine tests, or imaging studies, especially if a person has symptoms or a complicated medical history. Treatment for hypertension typically involves a combination of lifestyle changes and medication. The specific treatment plan will depend on various factors such as the severity of the hypertension, presence of other medical conditions, and overall health. Lifestyle changes. Maintaining a healthy diet low in salt and high in fruits, vegetables, and whole grains. Regular physical activity. Maintaining a healthy weight. Limiting alcohol consumption. Stopping smoking. Medication. Diuretics. Help remove excess fluid and salt from the body. ACE inhibitors. Lower blood pressure by relaxing blood vessels. Calcium channel blockers. Help to relax the muscles in the walls of blood vessels. Beta blockers. Slow the heart rate and decrease the force of each heartbeat. Renin inhibitors. Work by blocking the formation of a hormone that narrows blood vessels. It's important to follow the treatment plan recommended by a healthcare provider, as well as have regular follow-up appointments to monitor blood pressure and adjust the treatment if necessary. Lifestyle changes can be effective in controlling mild to moderate hypertension, but most people with high blood pressure will need to take medication to reach and maintain a healthy blood pressure level. Thanks for watching.